Hi guys, this is me Gayatri Prakash and welcome to my page. എല്ലാവർക്കും എൻ്റെ പേജിലോട്ട് സ്വാഗതം. So today I would like to discuss with you all about today's OET exam, 10th of September 2022. So I would like to discuss with you all about OET writing as well as speaking. Okay, so let's move on to the topic. So as per my students' feedback, today's letter was like unknown case letter, which means patient is moving from one place to another place with his son. Thereby, the writing person is a family practice nurse. So she is writing a letter about the complete history of the patient to the another nurse who is going to look after this patient once he moves to that particular place. Okay, so what is the patient details and the name and what is the patient condition, why he is moving to that place. So we'll see in detail. So patient name is Mr. Like I did not get even really a full name because my students, they were saying to me that his name is Pitchman, but I don't know the full name of that person, and he is 71 years old. Actually, what is the patient diagnosis, which means a transient ischemic attack which happened on December 2021. Thereby, the patient was admitted in the emergency department with the signs and symptoms of transient ischemic attack. Thereby, patient received adequate treatment and management, which includes warfarin therapy, and also patient was given advice regarding the diet management and habits, and also patient passed a medical history of hypertension, high cholesterol. Patient is on medication for the same, and also patient has the significant family history of stroke and a heart attack. Regarding his habits, patient is an alcoholic and he drinks 8 to 10 units per week, and he stopped smoking very recently with the help of quit smoking program. Patient usual diets are high salt and high fat, highly processed diet, and also patient walks 10 minutes with his dog, which means like less exercise. He lives alone, and also he has a misconception regarding the side effects of warfarin therapy. Thereby, he stopped taking the medications, and also poor compliance with the diet, because he is having the thought of like, in this age, what is the changes I can bring in my diet that won't really help me, so I won't follow a proper diet plan kind of mentality the patient is having. So he stopped taking proper food as well as the medications, and thereby the practice nurse who is writing this letter, she is advising the patient that it is very important for you to take the warfarin on right time, because it may cause you again the second attack of transient ischemic attack, as well as you may end up with a heart attack or else stroke. And also she just informed him to take a proper diet pattern, and these all are things can help you to overcome the risk factors of stroke and heart attack. And also patient is moving to which place patient is moving to Telworth with his son to have a normal life, so somebody can look after him in a proper way, as he is living alone and he is not following the proper medications and food patterns, and also he is drinking, and this and all unhealthy lifestyle which will cause him to get a stroke or a heart attack as soon as. So thereby the patient plans to move with his son where he is living Telworth. So within 2 weeks patient plans to move. As a practice nurse, she is writing this letter to that community practice nurse, who is going to look after Mr. Pittman. Okay, so this is the overall care plan of the patient. In between that, they have a multiple reviews. Patient had a review with the GP, patient had a review with the practice nurse. So they all were given the same advice. Especially his GP checked his warfarin level and it was same. So he advised the patient to continue the same dosage of the warfarin. And when he gone to the practice nurse came to know that the patient is having poor compliance with the diet regimen as well as the medication regimen. So she has given the advice to the patient, and also patient at last came with the plan of moving to Telworth with his to live with the son within 2 weeks. So thereby the nurse is writing this letter to that Telworth nurse to look after him, to monitor his medication compliance, monitor his warfarin level, also giving education regarding the importance of the proper diet and the medication compliance to prevent the risk of stroke and a heart attack. So this is the overall care plan about the patient. Now how we are going to write this letter? As usual, we have to write on the top of the paper today's date. So today's date they have given in the letter as like 8th of Jan 2022. So we have to write on the top of the paper 8th of Jan 2022 and then writing the addressing person's address, like to whom we are addressing this person. So that we have to write the address of the person without any comma, quotation, full stop. We have to write the plain address, and when we are writing the address, if they given the name, we have to write the full name of the person with the title. If they not given the name, we have to write the name. We have to write the designation of the person starting with the D, and also the first letter of the each word should be capital letter. And then we are writing the salutation of the person to whom we are writing this letter. We are just giving an intro of that person, and then writing the patient name in the reference as well as patient age. Now coming to the point of the introduction. So to make an introduction, as usual, we need 3 points. One is patient name, full name of the patient. Second thing is patient condition, and then purpose. So here actually the patient name is like I did not get the full name, so I can use Pittman only. And what is the condition of the patient? Transient ischemic attack which happened on December 2021, but still patient is on the treatment for the same. Okay, so here we can write who has been recuperating from. So we can write this is to introduce, because you are newly introducing, or this is to refer also, you can write it. So either you can two way you can write it, either this is to refer or this is to introduce Mr. Pittman, who has been recuperating from transient ischemic attack. Full stop. So what is the purpose? He requires continued care. So he requires what care? What care we have given, the same care they have to continue for the patient. So he requires your continued care and management. I like that. We can write it. If you want, you can write following. So following of what? Following. Actually, he's moving to the Telworth, right? So we can write following his shift to Telworth within 2 weeks. So that also we can write it as a continuation. So this is to introduce, or you can start, this is to refer Mr. Pittman, who has been recuperating from transient ischemic attack. He requires continuity of care and monitoring. Continuity of care and monitoring following his shift to Telworth within 2 weeks. So you can write it like this of the introduction. And then coming to the point of present medical history. So here we have a doubt. Either we have to start with an date of admission in the emergency department due to the transient ischemic attack, or how we can start. So there will be so many confusions in our mind. So for me, I can say that actually this patient under this practitioners, which means under your care for all the for the last 30 years. So we can start the letter in that way. So Mr. Pittman has been under my care or under my practice. So like that you can write Mr. Pittman has been under my practice for the last 30 years. So in that, what happened to the patient? So during this periods, like what and all happened to during this periods, patient had an admission on December 2021 due to transient ischemic attack. Therefore, he received warfarin therapy and dietary advice, which includes low salt, low fat, high fiber rich diet. Then what happened that as patient is having misconception regarding the side effects of the medication of warfarin as well as the dietary regimen, he has poor compliance with the diet as well as medication. So that is the point, we can return it over there. And also patient came further during his first review, his warfarin level was normal, thereby doctor advised to continue the same warfarin dosage of the medication. And then during his second review with the patient complains about the side effects of the medication and dietary regimen. He was advised regarding the importance of taking warfarin as well as the dietary, which includes high fiber, low salt, low fat diet. So these all things we have written in the present medical history paragraph. And coming to the social background, so he is living alone, right? The Mr. Pittman lives alone, and also if they have given any occupation of the patient, you can include it in that. Either he is a retired or either still he is working. So what they have given in your letter, you can write it in that. So Mr. Pittman lives alone, and he has a habit of consuming alcohol 8 to 10 units per week. He has had hypertension since 2000, I think it was 2016, since 2016, and high cholesterol since 2018. And we can write for which he is on amlodipine and atorvastatin. And he has most importantly, he has the significant family history of heart attack and stroke. So this is the family history, which is very important history to very important history about the patient, and also the nurse must know about him. And now coming to the point of the recommendation passage. So recommendation paragraph, what you can write, it would be greatly appreciated. So what they have to, it would be greatly appreciated if you could monitor his diet compliance as well as medication compliance to prevent the risk of stroke as well as like a heart attack. And also you can tell them you are just informing to them, kindly monitor his INR level, international ratio, as well as the warfarin level to continue the warfarin medications. So these are the recommendations that we are just informing to that nurse. And then as usual, the conclusion, please contact me for further details. And if they have given the name of the addressing person, you can wind up the letter with yours sincerely, or if they're not given, you can wind up the letter with yours faithfully. Then you are right, a family practitioners. So that's it. So the letter is very simple, and also we have to include all the important points, especially his poor medication compliance and the diet regimen. Also he is having the misconception regarding the side effects of the warfarin, as he was googled regarding the warfarin side effects, and since then he stopped taking the warfarin. So it is very important to notify to that nurse. That is the main reason for the patient to stop taking the medications. And also regarding the diet, because he is having the thought of like by doing changes in the diet nothing gonna happen, so I can't do any changes in the diet. What the diet I am eating, that is the one I will continue the same, because patient is eating high salt, high fat and processed diet. So this is the main reason. So as a practitioner, she is worrying about the patient condition as well as the complication of the conditions, which means patient may develop heart attack or the stroke, because already he has a significant family history of stroke and heart attack. So these are the main points that we must include in the letter. So first review with the doctor, his warfarin level was the same, so doctor advised him to continue the same. Second review with his practitioners, that time only the nurse came to know that patient is having the misconception regarding the warfarin side effects, as he came to know through the Google. And also he is having the strong decision about not to change the dietary pattern, because that will not bring any changes in his condition. So these things are very important thing to write it in your present medical history paragraph. And it is not very important to write about the admission and what happened. So you can just give a hint, like he had he had an admission in emergency department on December 2022 and was diagnosed with like ischemic heart attack and ischemic attack, transient ischemic attack. Therefore he was prescribed with like warfarin, how much mg they have written it, you can write it. And also he was given advice regarding the diet, which includes like low fat, low cholesterol and fiber rich diet. So that is the one thing we can write it over there. After that, the review what happened, and then social background, in which you are writing about the family medical history and the habits of the patient, and also living status of the patient. What is the past medical history, like as he has already hypertension and high cholesterol, he is on medication for the same. And also he is an alcohol consumer, and he stopped smoking with the help of quit smoking programs, and especially what he likes to eat. And also regarding the exercise program, he used to do regular exercise, only 15 minutes with the dog, with his dog he used to go for a walking. And this is the main things that we have to include in the social background of the patient. Okay, so overall the letter is so good, and I hope you all have done in a very good way. And regarding the speaking, so regarding the speaking, the topic was really there are too many conflict topics were there, because my students were saying to me, one is the patient is coming to see the relative, talking to the patient relative who wants to see the patient in ICU, who is already admitted in the ICU. They want to see the patient, so they are discussing with the nurse about the condition of the patient and when can visit, what is the visiting hours, why we should not go now, and it is kind of a conflict. As well as like we are explaining about the rules and regulations of ICU intensive care unit and when is the visiting hours. This was the one topic. And the second topic was carpal tunnel syndrome of the patient, who is asking about the advice regarding that. And then this third topic was like a patient who came to the emergency department with the signs and symptoms of fracture, and the patient also suspecting themselves that he is having a fracture, so that he is arguing with the nurse, why can't you diagnose myself and start the treatment immediately? And patient is saying, the nurse is saying that based on my signs and symptoms, it could be a fracture, also sometimes it could be a like a superficial ligament tear or something like that. So that the patient the nurse is asking the patient to wait until the doctor is coming to diagnose the patient. So the patient is a bit arguing and agitated with the nurse. So this is the third topic. And the fourth topic is like patient is getting discharged from the hospital after the shoulder fracture. So the nurse is giving the advice regarding the management of the shoulder fracture, like applying the splint and dietary management and medication importance, and wound care management. About these all other things is discussing by a nurse to the patient as a discharge advice. So these are other topics today they have asked, and I hope overall the writing and speaking was easy only, except reading and listening, because my students were saying to me that listening and reading was a bit tough compared to the last exam. Anyhow, hope for the best, and whomever wants to join in our class, we have 30 days, 40 days, 50 days, 60 days and 10 days crash course also available, and also beginners also, for the beginners also we are having online classes. So whomever wants to join in our class, you can contact us, and our number has given in our description. So until then, bye bye.